top of her class. She constantly writes notes when she comes in and follows me. And I said, just memorize 2 words, BOTOX heals. It heals profoundly. And I'm going to show you some photos to have you understand that. Next slide. So what are we talking about? Just like exercise, the first time you work out may be a little stiff, may not feel good. It may look good, but and then think of this, with BOTOX the first time you go, wow, I look really good. And then when it's gone, you get this craving, you need it again. Oh, let's get it again, let's get it again. I want you to look better. That's the endorphin rush analogy to exercise. But the thing that I want you to understand is that over time, if BOTOX is done consistently by a qualified, experienced injector that can deliver a better product, that fluctuation and variation gets smaller and smaller. And I can tell you, after 1 or 2 years of good BOTOX with me, even the person with the BOTOX completely gone looks almost as good as when it's there. The addiction is gone because I've healed the skin and relaxed the muscle. And that's really, really profound. I'm going to show you some slides to have you understand that. So you and I can partner, because part of the equation that's missing is BOTOX. Why? It's poison, it's dangerous. No, it's a fundamental rethinking of why it's so important. So we'll get to the point where the skin looks good. Next. I talk about this because it's true. As a lot of people say, come in and get BOTOX and call me when you want the next one. I'll set up the next appointment. The difference is that I want to train your muscles. What I'll do is I'll take metrics. At a year, I'm going to take your photo. I want to show you the improvement. When do I want to show you the improvement? When the BOTOX is gone, when you're coming back for the next round. I want to show you that fundamentally the skin is healed when the BOTOX is gone. Not there. Anyone can take a photograph 2 weeks later. I don't care about that. I want to get your mindset out of the quick fix. I'm talking about long-term healing. And that's what I want to show you is long-term gains with BOTOX. And that personal trainer will define metrics for you. And let's say your BOTOX is holding at 3 months. I'm going to push you to 4. What if it's not holding? We're going to stay at 3. What if I see one area that is not doing as well, progressed? I'll increase the dose. I'm going to work with you. Remember that phrase, BOTOX is a relationship. It's to let the skin heal. Next slide. This is a lady that hadn't done BOTOX before, started until about 60. And this is 4 years of BOTOX with me. The photo on the bottom is 6 months after her last BOTOX. There isn't an ounce of BOTOX in that photograph. She has complete mobility and freedom of that in that bottom photograph. But what you're seeing is complete, profound healing. You say, wait a second, that's trick photography here. I'm just seeing more than that. I'm seeing it's not only healing the big muscles, it's healing the skin. Are you insane, doctor? Are you introducing something crazy? No. No, I'm not at all. There's a concept out of the Philippines that I pulled in called micro-BOTOX, which is dropping little droplets of BOTOX into the dermal architecture. And think about it this way. We always are focused on big skeletal muscle. How about the smooth muscle? What controls your pores? What controls the textures? It's your smooth muscle. Where is BOTOX usually placed? With that big, heavy crunching noise and pain too deep? I'm not talking about that. Go superficial. Get it placed right between the smooth muscle and skeletal muscle. You're going to get profound healing if it's perfectly placed and distributed evenly over a wide arc. So you don't have this unusual crinkling. And so you get healing at the dermal level, even lesions, everything. And I don't do the rest of the face with this. I just do the movement area. So there's not really going to be a challenge for you in terms of, we can work as a relationship because the most movement's up here. And I always like the Vidal Sassoon thing, if you don't look good, I don't look good. And I'm going to help your clients look a hell of a lot better because we're going to work in a partnership to get that skin, because I can't do it without you either. Is it all about BOTOX? No. It's about understanding skin from a different level, a different paradigm. So if you look at this, everything is healed with no BOTOX on the bottom image. I want to repeat that to you. Next image. This is an esthetician who's 40-some years old, worked many, many years on her own skin, and this is 2 years after consistent BOTOX, 6 months after her last dose. The skin is healed. The skin is healed with no BOTOX on the image on the right. And the reason that's so profound is I want you to challenge you is what causes a wrinkle. Let's go back to fundamentals, this movement. If you understand wrinkles are a derivative product of movement, you understand that we must block the cause. Next slide. Next paradigm, light. Just want to make sure I'm staying on time. Next paradigm is light. Why does skin look bad or good? It's light. Light on the skin, right? Next slide. Do we look like this sometimes? Why do we look like this? Because, next slide, we always live in a world, next slide, always live in a world with overhead lights. Think about it for a brief moment. Unless you have a glorious diffuser, we always have overhead lights, wherever we are, outdoors, indoors, anywhere. It's always top down. So exemplify some problems. What are those? Next slide. Think about this. It's a new paradigm. You guys know I do fat grafting, so I'm going to talk a little about how that works on skin. Think about this very fundamental thing. If you, over time, become deflated in certain parts of the face, there are going to be exacerbations of wrinkles in transition zones. What I do is just reinflate it. So when we reinflate it, there's bounce. And think about one thing. When you see beautiful skin, can you not see it 30 feet away? The answer is yes. And it's partly due to what incredible work you guys do. And it's partly due to the fact that if I can give volume, I can create light reflex to show off your work a heck of a lot more. Next slide. What happens with aging? Is it just wrinkles? No, I just talked about wrinkles. Let's forget wrinkles. It's deflation. Even if we gain weight, it's deflation. It's parts of the body having deflation. What happens when the upper face becomes flat? Light coming from on top creates shadows, right? Next slide. What is the answer? This? Do we take that and move it further away? I'm sure you love this look, right? Next slide. No, because even if you stretch that skin over the bone, okay, using your foot maybe, you're going to have shadows. You can't stretch it over a skull. Doesn't work. We need to think about recontouring light reflex. So light on the skin as important as the skin itself. Next. Fat transfer. What is this? Let's clear the objections. Next slide. Justine, next. Why not fat transfer? Next. I'm going to look fat. I've gained some weight. This woman looks thinner. Do you want to do a brow lift on her? Didn't. How about suck out the eye bag? Didn't do it. I added volume to her face. But I can slim a face with fat, and I also can widen a face that's too gaunt. That's what's artistry. That's called balance. I want to take the vocabulary of symmetry out. We're so focused on symmetry. I want to say one thing. It's irrelevant. And I'm not going to go through the whole explanation. Micro evaluation of the face of symmetry will not help you. It's about understanding the beauty of balance, how one part of the face harmonizes with another. And when there's light, you say, well, you trick photography, you must put a flash on her face. No, it's the same lighting in the same no ambient light controlled room. So you're not going to look fat. I can take someone heavy and slim them with fat. Crazy? No. I can take someone too gaunt and widen them so they look balanced. And not when we're at 25. Most women like it around maybe 30, 32 if they pass 35 years of age. There's a little bit of narrowing that occurs. But we have this linear approach from baby fat to senescence or aging that we need to look at where that transection point is, or that transition point. How do we know that? Old photos. That's where we start, so you don't look like an unusual individual. Next slide. What's the next problem? It's not going to last. My doctor told me it's going to go away in 3 months. I've had it done. It's a joke. Is a Ferrari and a Hyundai the same car? No, they're different cars. So don't condemn the car. Don't condemn a car. Condemn the brand of the car. My mom over here, where is she? Over here is almost 2 years out. One session, including her hands. Almost 70. So the idea is to have you understand is, go look at her. Has it lasted? Yeah. It lasts in 95% of my cases, and 5% I touch it up at a year for free. So I want you to rethink that whole notion. Next slide. It's dangerous. I'm going to get lumps around my eyes. My doctor told me it's scary. Don't do it. He tried it. He couldn't do it. Don't let him do it. This is what's dangerous is conventional eyelid surgery. What's dangerous is the evacuation of the eye frame. Let's put it back in. But it looks heavy, Doc. Doesn't that still look heavy when it's too high?
Yeah. No makeup comparison. Same lighting, but there's not the same lighting because there's more light on the face. So rethink what you see. Next slide. I've never had a lump around the eyes, okay? Just to make that really clear. I just want a mini something. Let's just